I'm Ben Wattenberg. Last August, Congress passed and President Clinton signed the Personal Responsibility and Work Opportunity Act. That ended a federal entitlement of aid to the poor that had been in place for over 60 years. Welfare was sent back to the states. Now, reports are starting to come in from the front lines of welfare reform. Joining us to sort through the news are Isabel, Sawhill, R.J. Miller, Chair in Public Policy at the Urban Institute and President of the National Campaign to Prevent Teen Pregnancy, Andrew Bush, Director of the Welfare Policy Center at the Hudson Institute and co-author of Wisconsin's Welfare to Work program, Wendell Primus, former Deputy Assistant Secretary at the Health and Human Services Department and now Director of Income Security at the Center on Budget and Policy Priorities, and Robert Rector, a senior analyst at the Heritage Foundation and an advisor to Republican welfare policymakers. The topic before this House is welfare reform working? This week on Think Tank. For years, many conservative Republicans had campaigned against welfare, saying it hurt those it was trying to help. Then in 1992, the Democratic candidate Bill Clinton promised to end welfare as we know it. In 1994, Congress was taken over by Republicans making the same promise. Soon the GOP passed the most dramatic welfare reform bill in history. Bill Clinton was running for re-election. Abracadabra, strange bedfellows were born. When President Clinton signed welfare reform, critics charged the bill would shove 1 million children beneath the poverty line. The Personal Responsibility Act redirects federal welfare aid from Washington and out to the states. There are strings attached to the federal monies. Welfare recipients must go to work within 2 years. Legal immigrants are denied welfare benefits. Food stamps to childless, able-bodied adults are cut off after 3 months, even if the recipient does not have a job. Some states didn't wait for the federal government to act. Wisconsin, for example, had long been out front on welfare reform. In June of 1996, Governor Tommy Thompson signed into state law the strictest welfare provisions in the nation.
We declared the end of welfare in Wisconsin. We're lifting the gates that trap generations of families in a well of despair and dependency. And through W-2, we're giving them a powerful ladder that will allow them to climb out of the welfare trap and pursue the American dream.
The results so far? Caseloads in many states are dropping rapidly. But critics argue those getting off the welfare rolls now are the easy cases, able-bodied adults who can take advantage of a healthy economy, or those who were on welfare fraudulently. What might happen, they ask, when poor mothers or the unemployable are kicked off the rolls? Thank you, lady and gentlemen, for joining us. The panel today includes all of you are both scholars and have been active in the political process in this. And let me start by going around the room, starting with you, Robert Rector, just to get a quick sense of what we hear is going on in the field as welfare reform moves ahead.
What's going on is really a miracle beyond anyone's expectations. In almost every state, the welfare caseload is now beginning to fall rapidly. The illegitimate birth rate in the United States declined in the last measured year for the first time in about 30 years, but that's only the tip of the iceberg. In those states that have advanced reforms, particularly Wisconsin, by requiring work from welfare recipients, has already cut its AFDC caseload by 55%. Inside inner city Milwaukee, the caseload has dropped by a third. And moreover, as the reform becomes more implemented more precisely, the pace of caseload reduction is actually accelerating. As we speak at the present time, the caseload is dropping by 2% per month in Milwaukee, 4% in the rest of the state. welfare dependence is vanishing before our eyes.
All right. Andrew Bush, what are you hearing?
Well, I think that there's no question there's been a dramatic impact upon what's going on out there in the States and what is happening with the caseload, as Robert just said. I mean, there's two important elements to welfare reform, and the first is hitting right away, and it's a psychological element, which is it's changing the way recipients are thinking about aid, it's changing the way caseworkers approach them, it's changing that whole aura. There's a second important element to welfare reform, which is actually changing and reforming these systems so you're actually helping families do a better job of getting into jobs. I think the jury's still out on that. That's still going to be a longer-term process.
Wendell, Primus, you resigned from the Department of Health and Human Services because you thought this bill was going to be so bad. What do you hear? What's going on now?
We have had phenomenal caseload decreases, but they occurred under prior law. Look when they started, according to your graph. They started in March '94 before the Republicans even wrote this new bill. And it's primarily due to the economy and some of the changes that were taking place under prior law, under the case where we had an entitlement, didn't have a block grant, and we have no idea how this new law is going to work yet. The results aren't in. We cut $54 billion. We're going to kick off immigrants off the rolls. We're going to take 18 to 50s in the food stamp program. So we don't know what the impact of those changes are.
All right. Bell, Sawhill, and then we'll open it up. Yeah.
I think we do have to define what we mean by welfare reform. If we mean the process that started in the late 1980s by which states were given waivers by the federal government under the old law to do some new and different things, we could talk about that as reform. I think in terms of the new law, the most important, we don't know what its effects are going to be yet. It really hasn't kicked in yet. But I think the interesting question is to look at how states are using the new flexibility they've been given to do things differently.
Okay.
Are they innovating? Are they really doing something different?
Andrew Bush seems to be saying that even though the new law hasn't formally kicked in some of its aspects, that there has been a psychological bomb dropped, and that it has had a preemptive effect. Is that basically your point?
I think so, and I think it started with debates that have been going on with over welfare reform over the past couple of years, and it has had a significant effect on people who can leave the rolls early and the way caseworkers are talking to recipients.
But that really started with the Family Support Act. This idea of work requirements and not getting something for nothing was really a landmark idea that was passed in 1988. And then we had the recession, and so welfare rolls kicked up. But now, with the monies that were in that prior law, we were demanding more responsibility. And that's what's really driving these caseloads and the economy downward. It has nothing to do with the new law.
I think
nothing.
There are two links between the law and what's going on in
The
the
96
states.
law.
Yes.
Right.
First of all, under the old law, caseload increased by about 1/3 over the next 6 years. But what we're seeing now
But there
is
was a recession in there.
there was a recession, but caseload never grew like that under recession. The old law failed, okay? What we're seeing now is, first of all, we've changed the basis of funding. Under the old law, Tommy Thompson cut his caseload through aggressive reforms, cut his caseload in half. What happened to his money? We cut his federal money in half. We punished him for reducing caseload. Whereas other states doubled their caseload during the same period, we doubled their money. What we're saying under the new law is we're no longer going to punish you fiscally for reducing dependence. Also, even more importantly, many of the key reforms, work-oriented reforms, particularly a pay-for-performance requirement, which are driving the caseload down at record rates in Oregon and Wisconsin, were put into the federal law. This is not an open-ended block grant. There are tough work standards in the federal law. We went around the nation, we found out what worked, we put it in the federal law, so all the other states are going to have to do that in the future. They should have the same types of declines. Once they say you no longer get welfare for free, you must work for the benefits you get.
I think the fact has been that the declining caseloads are due to a number of factors. The economy has clearly played a role, the recovery from the last recession and the drop that we've seen. I also agree with Andy that there has been a psychological effect. I call it an announcement effect. Welfare recipients have heard that the rules of the game are changing, and so they're trying a little harder to get off the rolls faster, or they're not coming on originally. I think there's clearly some of that going on.
I don't disagree at all. I think the economy has had a huge impact upon this type of thing. But I disagree with the notion that the '96 law has had no impact on this type of thing.
Well, she said it does have an announcement effect.
It has a huge announcement effect,
right.
but also if you take a look at, for instance, the 1988 laws and those types of changes, what had happened were, yes, new requirements were put in, little types of things, but it didn't really change the culture, it didn't change the nature of the way the programs were working for the most part.
Let me just ask you a couple of questions that I know I have wondered about, and I think some of our viewers may have wondered about. When we say that this bill has ended welfare as we know it, that's true, but it hasn't ended welfare, and it hasn't ended the federal participation in welfare. Am I correct that the federal government still guarantees welfare payments, but the states administer it? Is that the new bill? It's not the new bill. Would you tell me what the new bill is? See,
The new
I'm
bill,
glad I'm in this
the new bill doesn't guarantee anybody anything. It provides a lump sum payment to a state, which is a fixed dollar amount that they can then use with some exceptions, important exceptions, pretty much the way they want to.
Why is that
to
not
provide various kinds of assistance. It doesn't have to be cash assistance. It could be social services. It could be job training. It could be a number of different things to needy families in their state.
Why is that not a guarantee?
Because the state can use the money in any way it likes.
Well, for poor people.
For poor people. But there's no individual entitlement to anything.
Under the old system, the more people a state signed up and put on AFDC, the more money the federal government gave them. It was a blank check, literally.
It was an entitlement to an individual.
Right. It's also an entitlement to the state,
right?
An entitlement to the state too. If you put someone in this program under conditions that you define, we pay you automatically. So the more people you have on welfare, the more money we send you. The fewer people you have on this program, the more money we take away. What we've changed here is to say we're not going to do it that way anymore. We're going to give you a fixed amount of money, increase it a little bit each year. If you cut your caseload, you get a surplus that you can use for other activities to aid the poor. If, on the other hand, you do something like California, you increase your caseload by 50%, it's on your dime, buddy. You have to pay for it.
Robert, it was not a blank check. I mean, the states under prior law could have had the toughest work requirement they would have wanted to. They could have put 50% of their recipients to work in community work experience programs. Those decisions were left to the states.
But then their grant would have been cut. Because
Yes,
it was
that's
a per
right.
capita.
If you cut your caseload in half, the grant fall. Also, but let's clarify, under the old law, it was very, very, very difficult to make recipients work. You had to go through all kinds of loops. What we've done is reverse this now, and now, in fact, states are required to make people work. It's exactly the opposite of the old law. You really had to go through a torture chamber in order to create a work requirement.
I don't believe that.
Law.
They didn't have to go through any torture chamber. I mean,
you never supported work, so don't tell us how easy it was. You were
Wisconsin's
opposed
program was instituted under prior law.
And
yes,
ask them
with some,
how easy it was.
Only in 2 counties was there the time limit, which required a waiver. But most of Wisconsin's programs, in terms of upping the work requirement, that could have been done under prior law, and it was done under prior law.
Very difficult to do that.
As an old presidential speechwriter, we have a little Latin crest that says rhetoric yields reality. How important was it in this process when a Democrat running for president in 1992 said he was going to end welfare as we know it? And let me ask the conservatives on this panel.
I think that was.
I know what you're all going to say.
I think that was significant. It was also even more significant that President Clinton was the first president, not even accepting Ronald Reagan, who came out and said that illegitimacy was a national crisis, and he needs to be commended for that. On the other hand, if you look at the actual reform bill that he wrote, as he said to you in an interview, it was a lousy liberal bill.
No, he didn't say it was a lousy liberal bill.
He didn't like, even he didn't like it very much,
Yeah,
okay?
That's what he said. He said he had some problems.
So
with it,
what needed, the second stage of the reform was a shotgun marriage between the rhetoric and a Republican reality in Congress, and all of a sudden you got real reform.
I mean, that leadership was important, but I don't think any of that legislation or anybody thought that legislation was going anywhere until Republicans took over Congress, because no legislation was going through any committee at that point in time, anything close to what was going on now.
Bill Sawhill, you were, I gather, the principal author of an Urban Institute study, which pretty well came to the same conclusion that a Department of HHS study came to, which is that if this welfare bill was passed, and it was passed, roughly 1 million children would be pushed into beneath the poverty line. You still stand by that?
Let me first correct for the record that I
Okay.
was not a principal author,
Okay.
but I'm certainly familiar with it. Be happy to talk about it.
It came from the Urban
It
Institute.
did come from the Urban Institute. I also want to note that it is purely a projection under a set of assumptions, and we shouldn't assume that it's necessarily going to come to pass, because it's simply a informed, educated guess about the future. It involves asking the question, under the new eligibility rules and the new time limits, how many people are likely to lose welfare. It then makes certain assumptions about how many of them will be able to find jobs. It makes rather optimistic assumptions, actually, about that. It says 2/3 of those who actually hit the 5-year time limit that's in the new bill will find jobs, but 1/3 won't. It also models or estimates the effects of the other parts of the bill that Wendell just referred to. And it says, in the end, our best estimate under these assumptions are, as you said, that roughly 1 million additional children will be made poor.
Is that still your best estimate? That 1 million poor children are going to be pushed beneath the poverty line? And I know Andy Bush, I want to hear what he has to say. Is that what you still think?
That's the latest study that we have, yes.
Okay, and you're nodding.
But with the caveats that, we actually did lots of estimates. We said, if you assume this, then the estimate
Right.
is such and such. That was a kind of
So there was
a
a
baseline
Urban Institute
estimate.
study, there was a Health and Human Services study, came to roughly the same idea, 1 million kids
Right.
beneath the poverty line. Andy Bush, something tells me you did not agree with that study.
Well, I don't think so. There are going to be dynamic effects that, quite frankly, we do not know what the answer is going to be. We do not know exactly what kind of impacts these things are going to have, but there are going to be dynamic effects on families who are now viewing welfare and coming to welfare offices and being told, you need to look for work, we're here to help you try to do that. And I think if you can help families get into positions where they're working, generating their own income, even if they're roughly at similar incomes to where they are now while they're on while they may have been on welfare, it's very important, because it establishes a very different situation for the children growing up in those families.
I think we have historical evidence that suggests this study was true. Compare the two recessions, the 1982 recession to the 1990 recession. In that first recession, we cut these programs and we got more poverty. In this last recession, we were actually spending more money, EITC, we allowed welfare rolls to increase. And as a result, the safety net worked better in this last recession. And we didn't do the cuts in the middle of the recession that we did in 1980. So based on that historical record, which I think is very clear, I think when you cut government benefits, you're going to get more poverty. And with $54 billion of cuts, plus allowed state cuts, we're going to see more poverty.
Can I just
If I
pick
could
up
let
on
your audience into a little reality here. First of all, the 5-year time limit that everyone hears about, that their studies assume, it doesn't exist because it doesn't affect state money. Secondly,
Whoa, you can't just state that. Why not?
Okay.
I mean, is everybody lying?
In AFDC, half the money is state money, half the money is federal money. Plus, there's a whole bunch of other fungible state money. If they want to keep people on welfare for over 5 years, all they have to do is apply the federal money to those that have been on a short time. They could be 100%. State money goes to the others. Every governor understands that. The 5-year time limit is a symbol. It has no policy reality. No one has to be thrown off. Secondly, what is really going on here is an overturning of all the conventional wisdom that these studies were based on. The old conventional wisdom cited by Senator Moynihan during the debate on this bill was that a work requirement, if you imposed it, a strenuous work requirement, might reduce the caseloads by maybe 5% over 3 years. In Wisconsin, the caseload is going down by that amount every single month.
Bell, you wanted to respond, and I want to ask one
Robert
question.
is right that technically there's room for the fungibility of funds here that would enable states to keep people on longer than 5 years if they wanted to, and if they had the resources to do it. It does require money, and they're going to have less money in the future than they've had in the past. But what he's ignoring
not true.
is the fact that many states are establishing time limits that are shorter than 5 years. And so 5 years is a somewhat optimistic assumption.
Let me ask
again.
this, just again, putting on our crystal ball eyeglasses. At the time this bill was being debated, I was just reading something that Senator Moynihan has written about his own remarks. He made the case several times that what we saw earlier when mental institutions when the patients were let go, we saw this huge rise in homeless people all around the country. He says you're going to see little children out in the street begging. That's his vision of what this welfare bill. Now, why don't each of you tell me what you think is going to happen? Is that plausible?
The reality is, if you require welfare recipients, if welfare is no longer a one-way handout, but you say you have to work in order to get these benefits, almost immediately about half the caseload is going to say, I have other things to do. If you're going to make me work for this welfare, I'm going to go and do other things. Another thing that we need to correct here is the notion that we've cut welfare spending. Absolutely untrue. In fact, over the last 4 years, the Clinton administration has increased welfare spending at near record rates. When you take all the programs to aid the poor, cash, food, housing, medical care, they went from about $300 billion when President Clinton took office. It's now $400 billion, almost a record increase. And even after the passage of this bill, that spending rate will continue to go up about 4%.
What's going to happen to the little kids
whose
mothers can't work, whose mothers are ill, whose mothers are ill-educated, whose fathers aren't paying support? Are these kids going to be, as Senator Moynihan said, out in the street begging?
Absolutely not. There will be residual funds from the state level, from other federal programs to pocket and catch them. The fact of the matter is that what you need to do in welfare is separate out those who truly need aid from those who are willing to take a free handout if you offer them one. By putting work requirements on welfare, that's what you do. And that in fact creates huge surpluses that can be, when you cut the caseload by eliminating those who don't need aid, you generate huge surpluses for additional services for those that truly
Andy,
do.
let's just go around the room and end this. Andy Bush, are the little kids going to suffer?
I don't think so. I mean, I think that what you've got to recognize with welfare reform is that no welfare reform is going to fix every type of problem that's out there. And we have 6 kids going hungry right now and homeless right now under welfare. Welfare of the past was never particularly great protection against that type of thing. You're going to have those types of situations. The question is, I mean, what's interesting about the welfare reform package with the money, as you talked about before, is that, quite frankly, most states are getting really a big chunk of money relative to what they would have gotten if we'd stayed under the current system to deal with AFDC. It's not so much the amount of money that's the issue, it's what they're able to do with it. They don't have to deal with an issue that is now, that was in the past oriented around an individual entitlement and passing money through to a family. What they can do now is use that money in very creative ways to help families stand on their own as much as possible. Okay. And that's going to be the real long-run test of welfare.
Wendell, Primus, are the kids going to suffer?
Some kids are going to suffer because, as you stated in your question, some of these mothers aren't very employable. It's a hard fact of life. Some of these mothers aren't going to be able to find work. And I think with the time limits, those children are going to have less shelter, less food. I think we shouldn't judge welfare reform just by what it does to caseloads. I want those mothers and fathers to be working as much as Robert does, but I also want to worry about child well-being. And I think we have to recognize that some of those fathers and those mothers aren't very employable.
Bell Sawhill, the last comment.
Well, I think it's going to be a mixed picture out there. We're already seeing a little evidence of what's likely to happen because some states are beginning to sanction people who don't show up for work or for other responsibilities. And there have been a few studies that suggest that some chunk of the people who are losing their welfare benefits are doing just fine. They've gotten jobs and they've substituted earnings for welfare. Other people are not. Other people are, as Wendell said, really dysfunctional in some ways and have great difficulty finding a job in today's economy, where you really need quite a bit of education and skill, and their children are going to be hurt.
Okay, thank you, Isabel Sawhill, Andrew Bush, Wendell Primus, and Robert Rector. And thank you. We enjoy hearing from our viewers. Please send your questions and comments to New River Media, 1150 17th Street Northwest, Washington, D.C. 20036, or email us at thinktank@pbs.org. And to learn more about Think Tank, visit PBS online at www.pbs.org. For Think Tank, I'm Ben Wattenberg.
This has been a production of BJW Incorporated in association with New River Media, which are solely responsible for its content.